first time I heard about Staphylococcus aureus, the first thing that comes to my mind is that Staphylococcus aureus is a sexually transmitted infection. Is it really a sexually transmitted infection? Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be telling you all you need to know about Staphylococcus aureus. Is it sexually transmitted? How is this infection? How is this disease, whatsoever you call it, transferred from person to person? Have we been misinformed? If you think it's sexually transmitted, if you think it's not sexually transmitted, please drop in the comment section before we proceed further into this video. But before we go further, if you are new on our YouTube channel, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. Alright, welcome back. Like I earlier said, today I'm going to be talking about staph infection. What is this staph infection? Staph infection is caused by a bacteria called Staphylococcus. I believe a lot of us have heard about Staphylococcus. So staph infection is caused by this bacteria known as Staphylococcus. It usually affects the skin. It usually affects the skin, and sometimes it goes on its own, it goes away on its own and doesn't require treatment. And sometimes it requires a treatment known as antibiotics because it is a bacteria. For those asking, how is this Staphylococcus transferred? Generally, this Staphylococcus is found living harmlessly in the skin. It's just in the skin. As far there's no break, there's no cut on the skin, it can stay in the skin. It can live there for hours, it can live there for weeks, it can live there for days. It stays in the skin and it is harmless. But when there is a cut, there's a scrape, or there's an opening in the skin, and this Staphylococcus gets into the skin, that is where the major infection results from. So Staphylococcus generally lives in a lot of people's surface of skin. It lives in the skin. But when there is a cut, there's a scrape, or there's an opening in the skin, and this Staphylococcus that's in the skin gets into that cut, that is where the infection problem start. That is where the infection begin. So generally, Staphylococcus aureus or staph infection is not a sexually transmitted infection, but it is an infection that is transferred through skin contact. So, though you can get it through sex, when there's a skin contact, there's an open skin and the Staphylococcus gets into the person's skin. But basically, staph infection is not a sexually transmitted infection. It is transferred through skin to skin. Now that takes us to the signs and symptoms that one is likely to experience. Remember I said it's an infection that affects the skin. I actually documented the signs and symptoms here. I don't really want to forget any, and I don't want to start racking my brain about the signs and symptoms. So the first one I have here is a painful red lump. A painful red lump, hot, red and swollen skin. That's the second one. Then the third one is sores, crust or blisters. Then the fourth one is sore red eyelid or eyes. Then we have pain, we have itching and painful blisters. There could be pain, itching and painful blisters, discoloration of that particular locations. All these things are signs and symptoms of Staphylococcus infection in the skin. When it comes to Staphylococcus, or when it comes to staph infection, there are some do's and don'ts you should do. And basically what these do's involve is your personal hygiene. First of all, you have to learn to wash your hands regularly. Remember, this staph is found in the skin. So if you don't wash your hand properly, it increases the chances of spread. It increases the chances of one getting it and also spreading it. So it's advisable you wash your hand regularly. It's advisable you bathe daily. Yeah, it's advisable you bathe daily. It's advisable you keep any clean cut clean and cover. Any cuts you have, any opening you have, you keep it clean and you cover it to avoid that staph infection from getting into that sore. Because you may have a cut, and you don't have staph in your skin. When somebody that has staph comes in contact with that cut, it might result in an infection. That is why it's advisable you cover your cut. It's advisable you cover that wound and keep it clean. Then the other one I have to share with you, use disposable tissues when you blow your nose. Then you don't when it comes to staph infection is that do not share towels, do not share sponge with people, because with that it can be transferred. Remember, it can stay in the skin, it can stay in the surfaces for days, for hours, and also for weeks. So it can be easily transferred if you share towels, if you share some sponge with someone, it can be easily transferred. When staph is on the skin, it has no effect. It doesn't affect you as far as on the skin. But when it gets into the bloodstream, it can cause problem to the various organs in the body. It can cause problem wherever it goes. For example, when staph gets to the breast, around the breast, it can cause breast infection, which is mastitis. And this is characterized by redness. It's characterized by pain around the breast. Then it can also cause pneumonia if it gets to the lungs. And this pneumonia, this person will be having fever, will be having pain, will be coughing. Cause blood infection. It can cause heart valve infection. It can also cause bone infection when it gets into the body, when it gets into the bloodstream. So it can cause different types of infection and affect the body functioning and body system. That is why hand washing and personal hygiene is very, very important. And also in the care setting, proper sterilization of instruments and also the environment in which our patient lives is also very, very important. Then that takes us to how this staph is being diagnosed. How do the doctor know that this my patient or this individual has Staphylococcus? In terms of this diagnosis, the signs and symptoms the patient portray, and also the blood test can be done. A test on the infected body fluid can be done. So the test on the body fluid, examination on the body fluid is a way to know that, oh, this person is being infected with staph or not. So this is more or less like a summary of staph infection I am here to share with you. So staph per se is not a sexually transmitted infection, but it is an infection that can be transmitted through the skin, and it is caused by a bacteria known as Staphylococcus. It can be treated with antibiotics, but in all, always see your doctor for proper test and also for proper examination. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mary saying thank you. Staphylococcus is not a sexually transmitted infection.